Stress is often dismissed as a normal part of modern life, something unavoidable and even expected. But what many people fail to realize is that stress is not just an emotional experience in the mind. It is a powerful biological event that directly affects the heart, blood vessels, hormones, and nervous system. And when stress becomes chronic, frequent, or unmanaged, it quietly becomes one of the most significant contributors to heart disease. When the body perceives stress, whether from work, pressure, financial concerns, family conflict, illness, lack of sleep, or even constant digital stimulation, it activates the sympathetic nervous system, commonly known as the fight or flight response, releasing hormones like adrenaline and cortisol into the bloodstream, which immediately increase heart rate, raise blood pressure, tighten blood vessels, and redirect blood flow to essential organs in preparation for action. And while this response is useful in short bursts during emergencies, the problem arises when the body remains in this heightened state for hours, days, or even years. Persistent elevation of stress hormones forces the heart to beat faster and harder than necessary, placing continuous strain on the cardiac muscle and arterial walls, leading to hypertension, endothelial damage, and eventually plaque formation inside arteries. Cortisol, often called the stress hormone, also increases blood sugar levels and promotes fat storage, especially around the abdomen, which is closely linked to insulin resistance and metabolic syndrome, both of which significantly raise cardiovascular risk. Stress additionally alters cholesterol balance by increasing triglycerides and LDL cholesterol, while sometimes lowering protective HDL cholesterol, creating a biochemical environment that accelerates arterial narrowing. Emotional stress can also trigger unhealthy coping behaviors, such as overeating, smoking, alcohol overconsumption, physical inactivity, and poor sleep, which compound cardiovascular strain. Research and clinical observation consistently show that individuals under chronic stress have higher rates of heart attacks, strokes, irregular heart rhythms, and even sudden cardiac events, and in some cases, intense emotional stress can trigger a phenomenon known as stress-induced cardiomyopathy, where the heart muscle temporarily weakens due to a surge of stress hormones. Beyond structural changes, stress profoundly affects heart rhythm by increasing susceptibility to palpitations and arrhythmias, especially in individuals who already have underlying heart disease. Another often overlooked effect is inflammation, because chronic stress elevates inflammatory markers in the bloodstream, and inflammation plays a central role in destabilizing arterial plaques, making them more likely to rupture and cause sudden blockages. Sleep disruption is another major pathway through which stress harms the heart, as insufficient or poor quality sleep prevents the cardiovascular system from recovering overnight, leading to sustained high blood pressure and impaired vascular function. Recognizing stress-related heart strain begins with awareness of warning signs such as persistent headaches, tightness in the chest, unexplained fatigue, elevated resting heart rate, frequent palpitations, irritability, poor concentration, digestive issues, and difficulty sleeping. Prevention and management require a comprehensive approach rather than a single quick fix, beginning with lifestyle adjustments that calm the nervous system and reduce hormonal surges. Regular physical activity is one of the most powerful stress reducers because it lowers cortisol, improves endorphin release, enhances circulation, and strengthens the heart muscle, with even brisk walking for 30 minutes daily providing measurable cardiovascular benefits. Structured breathing exercises and slow diaphragmatic breathing activate the parasympathetic nervous system, counteracting the fight or flight response and reducing heart rate and blood pressure within minutes. Mindfulness practices, meditation, prayer, or quiet reflection stabilize emotional responses and improve resilience against daily stressors. Maintaining strong social connections and supportive relationships significantly lowers stress-related cardiac risk because isolation amplifies cortisol release. Time management and setting realistic expectations prevent chronic overwhelm while learning To say no to excessive commitments protects mental and cardiac health. Balanced nutrition supports stress resistance, as diets rich in fruits, vegetables, whole grains, lean proteins, and omega-3 fatty acids reduce inflammation and improve vascular health. Limiting caffeine and alcohol can reduce heart rhythm disturbances and improve sleep quality. Creating a consistent sleep routine of 7 to 8 hours allows the heart to recover, repair vascular lining, and reset blood pressure patterns. Individuals recovering from cardiac procedures must be especially mindful of stress because the healing heart is more vulnerable to hormonal surges and rhythm instability, and cardiac rehabilitation programs often include stress management training precisely because emotional health directly influences recovery outcomes. Professional counseling or therapy can be transformative for those dealing with chronic anxiety, depression, or trauma, all of which are linked to increased cardiovascular events. Practical daily strategies such as journaling, spending time in nature, engaging in hobbies, listening to calming music, and practicing gratitude gradually rewire the brain's response to stress. Importantly, managing stress does not mean eliminating challenges from life, but changing the physiological response to those challenges so that the heart remains protected. Routine medical checkups are essential because stress-related hypertension or cholesterol changes often occur silently. Without obvious symptoms, self-monitoring blood pressure at home, tracking resting heart rate, and paying attention to physical warning signs empower early intervention. Over time, consistent stress reduction leads to measurable improvements in blood pressure, cholesterol levels, heart rate variability, and overall cardiovascular resilience. The heart is both a physical and emotional organ, responding not only to diet and exercise, but also to thoughts, feelings, and daily pressures, and protecting it requires acknowledging that mental well-being and heart health are inseparable. The empowering truth is that while stress is inevitable, its impact on the heart is modifiable. And by adopting structured stress management habits, prioritizing sleep, engaging in regular movement, maintaining social support, and seeking help when needed, individuals can dramatically reduce their risk of heart disease and improve both longevity and quality of life. Ultimately, caring for the heart means caring for the mind. And when stress is addressed intentionally and consistently, the heart beats not under pressure, but with strength, rhythm, and resilience for years to come.